is Tonya. I am a makeup artist. I love helping people to feel good. When you do someone's makeup and they look in the mirror and they can't take their eyes off themselves or they keep looking, if you could bottle that, we'd all be billionaires. I have this demanding job and I also have narcolepsy.
Tonya has a condition called narcolepsy. It's a sleep disorder, classified as a disorder of hypersomnolence.
It's characterized by a cluster of 4 symptoms: excessive sleepiness or sleep attacks, cataplexy, hypnagogic hallucinations, and sleep paralysis. Narcolepsy is a rare disorder. Just a fraction of 1% of the population has narcolepsy.
On average, it takes about 10 years for someone with narcolepsy to get to a sleep specialist and get properly diagnosed and treated.
I had only ever heard of narcolepsy or seen it in movies or on TV. I associated narcolepsy with me falling asleep in the middle of this conversation.
There are 2 types of narcolepsy: narcolepsy type 1, which is with cataplexy, and narcolepsy type 2, which is without cataplexy. Cataplexy is a symptom that's only seen in narcolepsy. It's a sudden muscle weakness that comes on in the context of strong emotion, typically positive emotions such as laughter or joy. Tonya has narcolepsy type 2.
The doctor said, you need to take this prescription. I was very against. I'd never had to take any medications or really had anything wrong with me, I guess.
Occasionally I run into people with narcolepsy who are a bit resistant to trying medications. Because it's a lifelong condition, it is kind of committing to medications for the rest of their lives usually. However, by the time a lot of patients get to me, they're struggling at work or in school, and so they're really ready to get started on some sort of treatment.
The treatments available for narcolepsy are available to treat the most prominent symptoms. First and foremost, available to treat excessive sleepiness. So there are wake-promoting medications that people can take in order to promote wakefulness throughout the day.
Tonya is being treated with a long-acting medication to help her stay awake during the day, as well as a short-acting medication that can be a little booster on particularly long days for her.
What I didn't realize until after being treated was how much I was sleepy during the day. The medication had helped to make my life much easier. It is worth trying to get help.
There's currently a good amount of treatments available for narcolepsy. There's medications that help people stay awake during the day, both long-acting and short-acting. It would be great to have more options out there for the treatment of cataplexy, so doctors have more of a choice and patients have more of a choice.
We know that the treatments that exist for narcolepsy today are limited, and we need better treatments. So in clinical trials, we're working on new drug treatments that bring safe and effective therapies to people who need them. One example of a clinical trial in narcolepsy is the REST-ON trial.
Patients who are eligible for this trial have to be at least 16 years old and had minimum exposure to sodium oxybate. They also need to have narcolepsy diagnosed along with cataplexy. This is a very rare condition and a difficult one to diagnose. So part of my role as trial ambassador is to reach out to the physician community and see if they have those patients in their patient population that can at least meet some of the minimum criteria for entry into the trial. It's critical that a medical provider be involved in this because it takes a fair amount of assessment and communication with the patient to diagnose and make them feel comfortable about being diagnosed with narcolepsy and potentially participating in a clinical trial.
I wouldn't have the medication that I'm on today if there hadn't been clinical trials that got to this point. There wouldn't be something as specialized, there wouldn't be a medication specifically for narcolepsy.
People are out there who need new treatments. They're waiting for them. And this is a trial that potentially offers that benefit.